Welcome to the Fix Your Gut YouTube channel. I'm John Brisson, author of Fix Your Gut and Health Coach. And tonight we're going to talk about what I believe to be an important topic, which is endoscope procedures. Now, endoscope procedure is where a flexible tube is inserted, through the oral cavity, down into the esophagus, possibly the stomach and the duodenum, depending on what the gastroenterologist needs to look at to determine your gastrointestinal issues. The tube that is used in the endoscope procedure has a light, forceps, and a camera, and the camera's at the end of the tube. It shows videos which a gastroenterologist can take pictures of and later reference to determine exactly what's going on with your digestive issues. Using the forceps, biopsies can be performed of the upper gut, consisting of the larynx, esophagus, stomach, duodenum, and you can get both. From biopsy, you can either have a histology, which is a cellular study, to determine if there is any changes within the cells of those parts of the upper gut. Or a microbiome culture could be run, and most of the time they check for H. pylori, for example, when they do a biopsy of the stomach during an endoscope. So what exactly entails an endoscope procedure? So usually endoscope procedures generally performed first time in the morning. It is usually an outpatient procedure. So usually during the night you are told to fast, and you're told to at least do not eat 8 hours before the procedure, and do not consume beverages or liquids 4 hours before the procedure. And the reason being is because when they're doing the procedure and they're sticking the tube down your stomach, you would not want to aspirate or vomit up any type of food or liquid, because of the tube blocking the proper closing of the upper esophageal sphincter and the epiglottis possibly could cause you to reflux or aspirate contents into your lungs, which can cause aspiration pneumonia or difficulty breathing, which both would require hospitalization. So during the procedure, you are sedated with anesthesia, and that does have its own associated risks, and we will talk about that later, as well as your oral cavity and esophagus is usually numb too as well during the procedure. So during the endoscope, you lie on your back, and the gastroenterologist begins to guide the camera. Usually it has a light at the end of the endoscope tube. And they go down to your upper gut, depending on where your issues are, all the way down to your duodenum, or possibly your biliary system, and we'll talk about that later. And they'll start taking pictures and possibly biopsies if needed for the histological or microbiome culture to determine what's going on. So usually the procedure takes about an hour, 30 minutes to an hour, and sometimes air can be added to during the procedure, or pumped through the tube to try to open up certain parts of your upper gut so that the gastroenterologist can get a better view, which may cause bloating and discomfort later. So be aware of that. And generally after the procedure, there's a recovery area, an outpatient recovery area, where we stay about an hour or so, just so that they make sure that there's no issues that occur from the procedure itself, and we'll talk about those issues in a moment. And generally afterwards, someone gets to drive you home because you were sedated. You were probably giving some pain medication if you were dealing with any pain, and you were probably too intoxicated to drive. And so that's usually what happens during an endoscope procedure. Now, common reported complications of the procedure are bleeding, aspiration, which aspiration is quite rare, but it is reported, esophageal scarring from damage to the esophagus, bloating from the air being introduced, very rarely esophageal rupture or a stomach or duodenal perforation, which is a medical emergency, which can cause severe infection. So usually if that occurs, you have to be hospitalized, but it's very rare. So endoscopes do have a purpose. They are important in determining the condition of the tissue of the esophagus. Usually diagnostic of Barrett's esophagus. Also, the condition of the larynx, which people with silent reflux usually have larynx issues because their upper esophageal sphincter is weakened. The functionality of both the upper esophageal sphincter and lower esophageal sphincter is usually tested to see if they open and close properly. Also conditions of the stomach and the duodenum like ulcer, gastritis, perforations, cancer throughout the whole entire upper gut system through the histology culture, or even H. pylori infection can sometimes be determined through the biopsies that are taken from an endoscope procedure. So endoscope procedures do have a purpose. But my main issue with them are the risks associated with them that your gastroenterologist may not emphasize. So there's two risks, I believe, with endoscope procedures. One is sedation, which actually Joan Rivers a couple of years ago, she tragically died from a standard endoscope, possibly because of sedation, a reaction that she had to sedation. And reactions to sedation or anesthesia are quite rare. Usually they're systemic reactions and trigger like anaphylactic shock or sometimes failure to recover from anesthesia. Endoscope procedure deaths have risen since the 1970s from 5 out of every 100,000 to 14 out of every 100,000 procedures that are done. Granted, that is somewhat of a small number. I mean, since 1975, 400 million sedated endoscope procedures have been done, and out of that you have about 55,000 deaths. So that's a lot of procedures, and that's kind of a low rate of death, but it is increasing though. And that could be from reactions from sedation or anesthesia reactions, because so many people take a lot of different medications now that may react negatively to the anesthesia with known or unknown side effects. Anesthesiologists, it's up to them to prescribe the right anesthesia when that would not react to any medications you're on. But there are some unknown mechanisms of actions or reactions that can occur that could cause issues or complications or even death. Another issue are infections, because it's very hard to properly clean the endoscope instruments for the procedure. I mean, even the FDA and the CDC have issued statements that infections are increasing. From 2010 to 2015, 350 patients around the world got severe infections from endoscope procedures. Now, there is one procedure which is known as endoscopic retrograde cholangiopancreatography. I hope I said that right. Where they take an endoscope and they go down into your duodenum and start checking out your biliary system, like your sphincter ovale and your pancreas, while doing x-rays to determine if there's anything going on in that general area. Might be a reason why those procedures have been implicated in the spreading and causing of severe infections, like even hepatitis C and MRSA, possibly because that general area, the biliary region, if it gets dysbiosis, it tends to be quite severe, so they might not be able to properly clean the endoscope instruments properly. So most of the infections were blamed on scopes that were not properly autoclaved or disinfected. Okay, so most scope instruments cannot be autoclaved, which is pretty much a method of using extreme heat or steam to sterilize an instrument. The reason being is because the scopes themselves, they contain a camera, they contain a lot of sensitive equipment, so they can't use those high temperatures, so instead they have to mainly use chemical disinfectants, which they might not be able to get into all the crevices and folds of the scope itself properly to be able to disinfect the scope itself, as well as some of those chemicals that they use as a disinfectant. Some people might be allergic to even very small, minute amounts that might be left, and that could cause a systemic allergic reaction or trigger even a localized allergic reaction. And maybe possibly the use of hydrogen peroxide actually might be better as a disinfectant, because it might be able to cover more surface area because of the foaming action. It's also able to break out biofilm really well, and it does dissipate fairly quickly. So it shouldn't leave any residue that anybody should be allergic to. You should have a little chance of allergic potential. So yeah, I mean, if they are going to clean them, I would suggest use to very high quality hydrogen peroxide, as well as there is a condom apparatus that can be put around endoscopes too, but no one's really using them. Doctors, gastroenterologists aren't using them. Hospitals aren't using them. They say the cost versus benefit isn't worth it. I think it could reduce the rate of infection. Now, granted, it would not be able to go over the part of the scope that they use for the biopsy, but nonetheless, I still think that it could help out in reducing infection. So yeah, I do think that endoscope procedures, even though they have an associated risk with them, as far as spreading infection or anesthesia risks, I do think that they are needed sometimes, especially if in medical emergencies where you think there, severe ulceration or perforation is occurring and you need to go down there and look exactly what's going on and where it is and how bad it is and if there's any infection, then yeah, I mean, that's definitely needed. But I do think that gastroenterologists do prescribe the procedure to be done a little bit too often. Like, you have to weigh whether or not it should be, or whether or not you can get any useful information of the state of your gastrointestinal health, the state of your upper gut health, of getting one done. So you kind of have to talk with your healthcare professional and say, hey, if you're having reflux and you're starting to get it under control, then maybe you don't necessarily need to have an endoscope procedure done unless it's severe, or you've had Barrett's esophagus in the past. There's some different reasons. Severe gastritis, you may want to have it done. But you might want to test for H. pylori first by using other means like stool antigen tests or a urea breath test, which those aren't perfect either. But if those test positive, the more likely H. pylori is the cause of gastritis. So maybe you should tackle the H. pylori first. But if your gastritis isn't getting better from doing that, then maybe you should have the procedure. I just think the procedure should be done more on a risk versus benefit case. Now, there is another endoscope type procedure called a transnasal esophagoscopy, where they actually go through your nose. Most ENT doctors perform this procedure instead of gastroenterologists, but they have a tube with a camera and they go through your nose instead of your mouth, so it doesn't require sedation, so at least does cut some of the associated risks of getting an endoscope procedure done. And they can go and look at your larynx and your esophagus, possibly your LES. It's not really used to look in the stomach so much, or the duodenum, because the tube isn't usually generally long enough, and an ENT doctor is doing it instead of a gastroenterologist, so usually an ENT doctor is not going to really be specialized to look at your stomach or your duodenum. But the scopes generally are actually cleaner because they don't go down into your stomach and your duodenum and your biliary region too. So if you're having reflux issues, but you're not suffering from gastritis or anything, if your issues are in the esophagus and the larynx and not in the stomach and the duodenum, then you probably want to get a transnasal esophagoscopy done if you need to get one done by an ENT doctor. They'll be able to check you out. Afterwards, one last thing is, after you do have the procedure, a lot of people have inflammation in their upper gut. So it might be a good idea, if you definitely run this by your healthcare professional, but I might recommend maybe supplementing later that day or that evening or the next day with slippery elm and DGL and zinc carnosine to maybe help reduce the inflammation in the upper gut, maybe help facilitate healing, maybe some collagen protein or bone broth if you could tolerate that may help as well. The slippery elm and collagen may help reinforce the mucosal barrier to some degree, which may help heal any damage or inflammation that's caused by the endoscope procedure. And so, if you want to take some anti-inflammatories like curcumin, or make sure you're getting enough omega-3 fatty acids in your diet, and getting proper sunlight exposure, then yeah, those are things that you might want to do after an endoscope procedure to possibly help with your recovery and to reduce any damage that is done to the tissue from the procedure itself. So yeah, I just, I'm not against endoscope procedures. I want to make that known. I just think that they should be on a risk versus benefit basis, as well as if you can get a transnasal esophagoscopy done, you should probably get one of those done. They appear to be safer compared to a standard endoscope. So you just have to weigh it, and if you do have to get one done, follow those tips I gave earlier, maybe help improve your recovery from having the procedure. So if anybody, is thinking about getting endoscope procedure or thinking they need one done, I hope this video helps you out. Please like and share the Fix Your Gut YouTube content if you enjoy it, and please subscribe. I hope you have a great day or evening.